Good afternoon, everyone. We are Group 4, and for today, we will be discussing about immunodeficiency. Next po. So, the learning objectives of this discussion are: first, identify the several types of immunodeficiency illnesses, including acquired and congenital ones, and their classification. Second, assess the effects of severe combination immunodeficiencies and antibody shortages on the function of B and T cells. Last, examine congenital immunodeficiency treatment solutions as well as methods for treating and preventing acquired immunodeficiency syndromes such as HIV or AIDS. Next. So, introduction. So, what is immunodeficiency? So, it is a condition in which the immune system's ability to fight off infectious illnesses and other foreign invaders is impaired or diminished. So, nagre-refer daw siya sa state na kung saan yung ability ng immune system natin na labanan ang mga pathogens such as bacteria, viruses, and fungi ay compromised or weak. This impairment can result from various factors, kasama na dito ang genetic defects, acquired conditions, medications, and environmental factors. So, immunodeficiencies can be primary or secondary, and this will be further discussed by my groupmates later. Next slide po. So, ito yung mga general features ng immunodeficiency. First is an increased susceptibility to infections. Individuals with immunodeficiency are more likely to get recurring or serious infections, which are frequently caused by pathogens that are generally harmless to those with a healthy immune system. Isa sa mga reason dito ay yung pagkakaroon ng weakened immune system because immunodeficiency impairs the ability of the immune system para ma-recognize, mag-respond at ma-eliminate ang mga pathogens effectively. So kahit yung ibang pathogens ay harmless or madaling makontrol ng tao na may healthy immune system, pwede pa rin itong mag-cause ng infection that are more severe sa mga taong may immunodeficiency. So next po is the recurring infection. Immunodeficiency can cause frequent or chronic infections, including lung infections such as pneumonia, skin infections, gastrointestinal infections, and systemic infections. So, isa sa mga reason din kung bakit nagkukos ng frequent or chronic infection ang immunodeficiency ay dahil ito sa impaired immune response. So, meaning this leads to deficiencies or dysfunctions in various components of the immune system tulad ng white blood cells, antibodies, at cytokines. So, this impairment reduces the body's ability to recognize, respond to, and eliminate pathogens effectively, increasing the likelihood of infections. Last is the opportunistic infections. Immunodeficiency may allow opportunistic microorganisms to develop serious infections despite the fact that they do not normally cause disease in individuals with a healthy immune system. So, yung immunodeficiency ay nagka-create ng environment conducive to the development of serious infections by opportunistic microorganisms. Yung infection na to ay may pagka-challenging na gamutin kasi it may acquire aggressive medical intervention to control and prevent complications. Next slide po. So, ito naman yung mga general causes ng immunodeficiency. For medical treatments, chemotherapy, radiation therapy, and immunosuppressive medications used in organ transplantation or autoimmune diseases can suppress the immune system. So, this chronic disease can compromise immune function over time through a combination of factors. Kasama dito yung mga immunosuppressive medications, metabolic abnormalities, malnutrition, organic dysfunction, cancer-related immune suppression, and underlying immune dysregulation. Next cause is age. Immune function declines with age increasing vulnerability to infections, and reducing vaccine efficacy in older people. So dito, pinag-uusapan is yung sa vaccine efficacy in older people. Effective pa rin naman yung vaccine, although it may also vary depending on factors such as the specific vaccine na tinake, individual's immune status at yung health conditions ng isang tao. While the immune response to vaccines naman generally declines with age due to immunosenescence. Ito yung mga age-related changes sa immune system, but still importante pa rin yung mga vaccines despite of our age dahil matutulungan tayo nitong maiwasan ng mga infectious diseases at mabawasan yung kalubhaan ng sakit sa mga older adults. So last is the environmental factors, which involves environmental contaminants, pollution, and radiation. Can weaken the immune system. Pero paano? So yung environmental contaminants such as heavy metals, pesticides, industrial chemicals, example nito ay dioxins and air pollutants, ay may mga toxic na effect sa ating immune cells and tissues. Exposure to these substances can impair immune function by damaging our immune cells, disrupting immune signaling pathways, and compromising the integrity of immune organs. Sa environmental pollutants naman, it can induce inflammation in the body na maaring mag-dysregulate ng immune function at makapinsala sa kakayahan ng katawan to mount an effective response to pathogens. Last is yung radiation. It can also weaken our immune system by ionizing radiation from sources tulad ng medical imaging procedures, nuclear accidents, and occupational exposures na maaaring makaapekto sa ating immune system. Immune cells are tissue that can suppress immune function and increase susceptibility to infections. So let's move on to the next slide that will be presented by Ms. Malong.
So I'm going to talk about congenital or primary immunodeficiency. As mentioned before, immunodeficiency disorders are a result of defects in one or more components of our immune system. Congenital immunodeficiency is example ng genetic defect, meaning inherited siya. This results sa pagtaas ng susceptibility sa mga infection na magmamanifest usually during infancy or during early childhood, pero may instances din na nadedetect siya later in life. Congenital immunodeficiency is also known as defects sa components ng innate system. They commonly involve phagocytes or complement pathway, and as we all know, yung complement pathway system or complement system ay crucial part of the innate immune response kasi may group of proteins na tumutulong in various mechanisms para ma-eliminate yung pathogens. For instance, opsonization and inflammation. Kaya pag defective yung complement pathway, mahihirapan mag-clear ng infections yung phagocytes. May iba't ibang specific congenital immunodeficiencies involving complement pathways such as C3 deficiency. So inherited abnormalities can occur in stages of lymphocyte development and during response of mature lymphocytes to antigenic stimulation. So paano nag-o-occur yung defects sa stages ng lymphocyte development? Nagkakos nito are mutations in genes na nag-encode ng enzymes, adaptors, transport proteins, and transcription factors sa iba't ibang stages ng lymphocyte development. And pag nag-occur naman ito, during response sa mature lymphocytes, for instance, sa V lymphocyte development, it will result in deficient antibody production na pwede ma-diagnose by ways na I'll be mentioning later. Itong defective antibody magre-respond sa vaccination and in some cases, reduced numbers of B cells in the circulation or lymphoid tissues or absent plasma cells in tissues. On the other hand, pag nangyari naman to sa T lymphocyte maturation, is magkakaroon ng deficient cell-mediated immunity and pwede mag-result sa reduced T cell-dependent antibody production. So, paano naman nadadiagnose ang congenital immunodeficiency disorders? Congenital immunodeficiencies are diagnosed by reduced numbers of peripheral blood T cells. Ito yung ginagamit sa pagdiagnose ng katulad ng sinabi ko kanina, pag nag-occur yung defect sa B lymphocyte development. Another way is pag mababa yung reaction ng pagdami ng lymphocyte sa mga polyclonal T cell activators or pwede din by DTH reactions, for instance, Candida antigen. Next, I will be discussing immunodeficiencies caused by inherited mutations in genes encoding components of the innate immune system or in genes required for lymphocyte development and activation. So, as you can see dito sa slide, ito yung mga relevant disorders. As discussed way before by Ma'am Irish, innate immunity yung first line ng defense against infection. So, if ang defect ay nag-occur sa innate system, yung congenital disorders of phagocytes and the complement system ay nagre-result sa recurrent infections. Ang example is itong Chidiac-Higashi syndrome, leukocyte adhesion deficiency, and chronic granulomatous disease. Yung Chidiac-Higashi syndrome, ang mechanism of defect nitong syndrome is mutation sa LYST or also known as CHS1 leading to defect in secretory granule exocytosis and lysosomal function. Nagkakaroon ng mutation sa lysosomal trafficking regular protein na nagre-result sa decrease ng phagocytosis. Ang clinical feature nito would be partial albinism as you can see in the photo. Sa leukocyte adhesion deficiency naman, may 3 types ang disorder na to. These are defects in the ability of leukocytes to adhere to blood vessel walls and migrate to sites of infection or inflammation. Lastly is yung chronic granulomatous disease, which is a defect in the function of phagocytes, particularly neutrophils and macrophages. Itong mga defects impair the ability of phagocytes to effectively kill certain types of bacteria and fungi. Next slide. So, ito po yung additional lang na congenital disorders ng innate immunity.
Yes po. We're talking about severe combined immunodeficiencies or SCID. It is a group of immunodeficiencies that affect both the humoral and the cell-mediated immunity. Development and functions of B and T cells are defective. If ineffective ang B and T cells and reliant lang po ang katawan solely sa innate immunity, then it reduces the capacity for long-term protection ng katawan natin, and infections will continue to reoccur. Also, SCID patients are prohibited from having live attenuated vaccines due to the danger of live attenuated vaccines returning to its virulent form. And imbis na makatulong yung vaccines, mas makakasama pa. Also, SCID is characterized by low numbers of circulating lymphocytes, and that is because in the lymphocyte development po, may process ng selective selection event na failure in the positive selection process undergo apoptosis. Yung negative selection na yun may kaya magkakaroon ng low numbers of circulating lymphocytes, and that negatively affects the immune response rate. And also, the insufficient number of T cells causes the thymus to not fully develop. Next slide po. Yeah. Now we're talking about the causes of SCID, which the mutations in the genes involved in the different steps of lymphocyte development. It will be further discussed in next slides. So, thank you. Yes, po. Now, the first defective po is defective in cytokine signaling. Mutation po from cytokines and cytokine receptors components ay maaaring mag-cause ng defective immune cell development, maturation, and so as ineffective and functioning. Because again, cytokines are the signaling molecules na nag-regulate, nag-coordinate ng immune cell communication natin. Now, X-linked SCID is caused by mutations in the gene encoding the common gamma chain of the interleukin 2 receptor is shared by several interleukin receptor. Now, kaya po tinawag na X-linked kasi po sa males na nagmamanifest yung disease, and while sa females are just carriers. X-linked XCID SCIDs is characterized by impaired maturation of T cells and NK cells because the defect po is in the interleukin 2 receptor gamma chain located in the X chromosomes, which is essential component ng several interleukin receptors, including na po yung interleukin 7, which is responsible for the B cell development, and so as the interleukin 15 for responsible for the NK cell development. Now, for autosomal recessive mutation naman po, it is only in the interleukin 7 alpha chain mutation, and the defect is only in the T cell development, but exhibit normal NK cell development kasi unaffected naman po yung interleukin 15, hindi katulad na sa sex-linked po. Next slide po. Thank you. Defective VDJ recombinations naman. The mutation in the genes for RAG1, RAG2, Artemis, and the other proteins involved in the recombination process. These components po are no longer or just partially in play, thus leads to the lack of diverse antigen receptor gene in the B cells and the T cells, making po the immune response to wide range of pathogens impossible. Now, in the defect naman po in nucleotide salvage pathways, impairment in the biochemical processes responsible for recycling nucleotides within the cells, ADAD, or adenosine deaminase enzymes, has a crucial role in the breakdown of purines and adenosines. Kaya may deficient in ADA, this leads to adenosine accumulation, which is toxic to developing T cells that will indirectly affect po the B cell functions. Now, in PNP deficiency naman po, the purine nucleoside phosphorylase deficiency of this enzyme results accumulation of deoxyguanosine and deoxyniacin, which are toxic and will inhibit DNA synthesis and induce apoptosis in developing T cells, lowering the number of circulating lymphocytes po. Thank you. And defective thymic development naman po. Abnormalities po ito sa formation and mutation of the thymus gland during the embryonic development that results in maging maliit yung thymus, like the thymic hypoplasia, or magkaroon ng structural deformity, thymic dysplasia, or absence of thymus itself, thymic aplasia. Now, the George syndrome affects the development of certain organs such as thymus. That's why nag-fall po ito sa defective thymic development. This is caused by the missing piece of chromosome 22 and the transcription factor called the TBOX1, which is usually genetic random mutation na po. This leads to deficient T cell maturation, absent parotid gland causing abnormal calcium hemostasis, and muscle twitching, and so as facial deformities. Now, this one is a bare lymphocyte syndrome naman po, also known as BLS, also known as a class 2 MHC deficiency kasi again, class 1 MHC is present in all nucleated cells. However, class 2 MHCs naman po ay for APCs. In class 2 MHC deficiency, macrophages and so as dendritic cells fail to express class 2 MHC molecules in the lymphocytes, kaya bare ang tawag, as in walang MHC na kaya makipag-interact with the T helper cells, thus compromising both the cellular and the humoral immune response against pathogens naman po. This results in defective positive selection of T cells because again, developing T cells are exposed po to self-antigens by APCs binded sa MHC molecules, and if mag-fail po ang antigen presentation caused by MHC deficiency, then T cells will not receive signs for positive selection and cells will not mature and will undergo apoptosis. Next slide po. Now, this one naman po is class 1 MHC deficiency, decrease in the CD8 T cell number and the functions due to the mutation in TAP1 and TAP2 genes. The mutation po in TAP1 and TAP2 genes that disrupts their functionality of loading the peptide antigens onto the class 1 MHC molecules. That's why pinakita po to sa diagram na yung pagdating sa top, magko-combine po, magko-create ng MHC peptide complex, pero may deficient po, may abnormality. And this will impair the ability of CD8 T cells to recognize and eliminate cell effectively, resulting in patients to be more susceptible to viral infections. Next slide po. Now, ito naman po is defective in T cell activation. It is rare cause of SCID, mutation in the ORI1 gene encoding, which is necessary for activation, proliferation, and production. The mutation in ORI1 does not exhibit defects in the T cell development, but their T cells cannot be properly activated since the T cells may not receive enough signaling to activate an effective immune response. Yan lang po.
So for for antibody deficiencies and defects in B cells development and activation, so defects in T cells development or in both T or B cells development, nagko-contribute siya sa SCID phenotype na nagmo-more circumscribed defect siya sa B cells, nag-resulting ng disorders in which primarily abnormality is in antibody production. And some of these disorders are caused by defects in B cell development, and other are caused by abnormal B cells activation and antibody synthesis na ma-discuss ko after this slide. And some of these disorders can be caused by defects of B cells development, and some of them are from abnormal B cells activation and antibody synthesis. And however, in one subset of hyper-IgM syndromes, antibody deficiencies are also accompanied by defects in macrophages and APC activation, which in turn result in attenuated cell-mediated immunity. Next slide po. So these are the deficiency in B cells differentiation. Defects in B cell differentiation, common variable immunodeficiency is a group of heterogeneous disorder defined by reduced levels of serum Ig at impaired antibody responses to infection at vaccines and increased incidence of infections. Nadadiagnose siya usually kapag yung other immunodeficiencies diseases ay na-ruled out. And so these are the associated pygogenic infection or major components is yung mga Haemophilus influenza, Streptococcus pneumoniae, and for clinically significance is pernicious anemia, hemolytic anemia, inflammatory bowel disease, and rheumatoid arthritis. And malignant tumors, lymphomas are associated with common variable. Deficiency lang siya. So these those disorders can be diagnosed early in childhood or late in life. Defective antibodies production can be attributed to multiple abnormalities. Kasama na dito yung intrinsic B cells defects or deficiency ng T cell help. And some people na may common variables, deficiency meron silang mutation ng ICOS gene or attribute T cells co-stimulator. Ang pinaka-common cause of this syndrome ay existence ng mutation ng TACI or TACI. Sa case common ng variable deficiency ay link siya sa mutation ng CD19 gene, and CD19 gene ay signaling component siya ng CR2 or CD21 co-receptor complex.
Hello po. Yes po. Defect in T lymphocyte activations and function. There's a lot of components in T cell activation and so as its function. A single defect can disrupt the T cell effectivity, and one of this is a defect in the MHC expression. This can compromise the immune surveillance. Thus, magiging madali pa ang pag-invade ng pathogens. And again, the best example of this is the bare lymphocytes that was already discussed in the previous slides. And the next defect naman po is T-cell signaling. T-cell signaling is caused by genetic mutation affecting the components of T-cell receptor complex. An example is the Wiskott-Aldrich syndrome, a rare genetic disorder characterized by eczema, thrombocytopenia, and immune deficiency. This syndrome may affect the TCR arrangement due to the mutations, causing atopic dermatitis, very few platelets, and high susceptibility to infection. And next slide. Yeah, familial hemophagocytic lymphocytosis syndromes, a rare and severe immune disorder in which the NK cells and the cytotoxic lymphocytes are defective in their ability to kill infected cells, leading to excessive inflammation and tissue damages throughout the body. One of the clinical manifestations po nito are fever, hematoblastnomegaly, which is an abnormal and enlargement of both the liver spleen, and so as in deficiency and the reduction in the number of mature blood cells circulating in the bloodstream, anemia, and in leukopenia, and so as coagulopathy, which is abnormality in the coagulation, and so as dysfunction in the nervous system.
So let's move forward to the secondary or acquired immunodeficiency which arises from external factors. So ano ba tong external factors na to? Acquired immunodeficiencies result from various factors such as underlying illnesses, treatments, and infections. Immunosuppression may occur as a biologic complications of another disease process. Some diseases can directly affect immune cells na nagkakos ng dysfunction or depletion. Example is the HIV infection targeting CD4 positive T cells na kailangan sa immune response against pathogens. Iatrogenic immunodeficiencies. Immunodeficiency can also result from medical treatments intended for other conditions. These are the drugs na mas nawiweaken yung immune system ng isang tao dahil natatarget yung lymphocytes na responsible for immune response. Possibly may cytotoxic effects sa rapidly dividing cells, pwedeng dinidisrupt nila yung cell cycle and ini-induce yung cell apoptosis. Pwede ring immunosuppressive drugs targeting signaling pathways, drugs that can impair their function as immune cells and alter their trafficking. Infections that target cells of the immune system as mentioned earlier. Acquired immunodeficiency is most common in malnutrition, neoplasms, and infections. Neoplasms are tumors, yung abnormal growth ng cells. Tumors can be categorized into two main types based on their behavior. The benign tumors, which are non-cancerous, meaning hindi sila nagsispread to other parts of the body, slow ang growth, and localized to one area. Malignant tumors are cancers na may ability to spread or invade yung tissues and distant organs through a process called metastasis. Next slide, please. Deficiencies of the immune system often develop because of abnormalities that are not genetic but acquired during life. HIV infection, depletion of CD4 positive T cells, which will be further explained by another reporter later on. Protein calorie malnutrition or PCM. As we all know, maraming significant role ang protein. So with low protein intake, mababa yung production ng antibodies and cytokines kaya nagiging impaired since nahihirapan yung lymphocytes na mag-function as immune cells. Calorie deficiency results in less energy available for lymphocyte maturation and function. Irradiation and chemotherapy. Ito yung common treatments for cancer patients. Tina-target and kinikil nila yung cancer cells. So paano nila naaapektuhan yung healthy cells sa bone marrow, particularly yung immature cells. Since bone marrow ang main site ng production of new blood cells, including lymphocytes, yung treatments na to pwede nilang ma-reduce yung number ng immature cells na magde-develop into lymphocytes.
Kapag mababa yung immature cells sa bone marrow, mahihirapan yung body mag-produce ng new lymphocytes. This means non-specificity at merong unintended effects sa ibang cells. So, chemotherapeutic drugs are cytotoxic to proliferating cells, including mature and developing lymphocytes. Next slide, please. Metastatic cancer and leukemia involving bone marrow where hematopoietic stem cells normally differentiate into mature leukocyte. Take note na advanced cancer is a prime example where immunodeficiency can occur. Metastatic cancer is considered as advanced cancer. In a way na nag-progress na siya sa initial stage, ay nag-progress na beyond its initial stage at naging aggressive and invasive. Na-i-impair yung ability ng hematopoietic stem cells na mag-differentiate into mature leukocytes dahil sa presence ng cancer cells. Yung cytokines na napaproduce ng cancer cells may immunosuppressive effects na sila. Kaya nai-inhibit yung differentiation and maturation ng hematopoietic stem cells into mature leukocytes. Next slide, please. Next slide po. Doctors commonly administer immunosuppressive drugs to ease the immune system and prevent it from causing harm. It can help kasi na matreat yung condition para yung immune system ng body hindi niya ma-attack yung own tissues and yung ma-prevent yung pag-attack sa transplanted organ. These drugs work in a couple of ways. First, nire-reduce nila yung activity ng lymphocytes para ma-prevent yung pag-attack sa transplanted organ o yung own tissue sa body. Second, they block the action of certain cytokines which are signaling molecules that tell immune cells what to do, which means these drugs prevent the activation of lymphocytes. Third, nag-i-impair sila sa movement ng white blood cells mag-travel sa areas na pwede sila mag-cause ng damage or mag-target ng tissues. Panood lang po na hindi ko nasama si PPT. The most commonly used anti-inflammatory and immunosuppressive drugs are corticosteroids and cyclosporine. Yung corticosteroids, ini-induce nila yung state of lymphocyte hyporesponsiveness kaya yung T cells nagiging less responsive to activation signals. Spleen contains macrophages which engulf and destroy bacteria in the blood. Without the spleen, this clearance mechanism is impaired. Thus, it allows the bacteria, especially encapsulated bacteria, to circulate in the bloodstream for longer periods. Next slide po. Next, I'll be discussing the diseases of secondary immunodeficiency. First is the Hodgkin's disease. Hodgkin's disease is a malignant or cancerous disorder of the lymphatic system. It involves the abnormal growth of cells in the lymphatic tissues. A type of lymphoma often results in a decrease in T cell function causing an inability to mount TTH reactions or delayed type hypersensitivity, reduced responses to polyclonal activators, and an overall deficiency in cell-mediated immune responses known as anergy. The cancerous cells can directly suppress the function of T cells through various mechanisms. For example, cancer cells may produce factors or molecules that inhibit the activation and function of T cells. The DTH, delayed type hypersensitivity reactions, are immune responses na nag-occur kapag yung body is exposed sa certain antigens. T cells play a significant role in initiating these reactions. However, in Hodgkin's disease, the decreased function of T cells can lead to an inability to mount TTH reactions when antigens are encountered. Polyclonal activators are substances that stimulate T cells to multiply and respond to infections. So in individuals with Hodgkin's disease, their T cells may show reduced responsiveness to these activators. Yung exact reason ng T cell abnormalities is not fully understood. pero kinoconsider yung factors produced by the cancer cells themselves or ibang mechanisms ng immune system sa body. It typically begins in a lymph node in one or more locations throughout the body. Since Hodgkin's lymphoma is malignant or cancerous, next slide please. Since Hodgkin's lymphoma is malignant or cancerous, it can spread to other organs beyond the lymphatic system. Next is leukemia. In leukemia, may abnormal increase ng white blood cells pero it's either immature or dysfunctional cells na nag-fail to mature into fully functional leukocytes. This abnormal proliferation of immature cells in the bone marrow leads to a decrease in the production of normal blood cells and increase sa number ng abnormal white blood cells circulating in the bloodstream. Treatments for leukemia is chemotherapy, targeted therapy, and radiotherapy.
So, the next topic is human immunodeficiency virus or HIV. Wait lang. HIV is a retrovirus that causes an infection that attacks the body's white blood cells, mainly CD4 T lymphocytes. The virus itself does not kill the individual, but because of the weakened immune system, most deaths happen because of other infections that the immune system is unable to fight off. Wait lang po. Kaya madalas, HIV is only listed as an underlying cause kasi nga, hindi siya talaga directly nakakapag-kill ng individual. Next is transmission. How do you get HIV? Contact with certain bodily fluids from infected individuals such as semen or pre-seminal fluid, rectal fluid, vaginal fluid, blood, and breast milk. Which leads us to the common ways you can get it, which is unprotected sex with infected person, sharing needles, contact of infected blood through open wounds, through pregnancy, or a baby drinking breast milk from an infected mom. Yung sharing needles usually drug-related, but it can also happen when reusing needles instead of using sterile ones. Although yung last two, which is pregnancy and baby drinking breast milk, medyo less common na siya since there are ways to prevent this from happening. These are some ways na HIV is not transmitted, which is through saliva, tears, or sweat, which is common misconception when HIV was first recognized. Which leads us to the next part, the origin. Studies have shown that the virus originated from a species of chimpanzees from Central Africa. It was called the simian immunodeficiency virus. Studies have shown that the disease or virus rather jumped to humans as far back as in the 1800s. It was originally called the gay-related immune deficiency because when the HIV global epidemic started way back in 1981, it was rampant among gay men and or bisexual men who have intercourse with other men. 1959 is the first known case, but in 1981 was the epidemic, and in 1996 the HAART treatment or highly active antiretroviral therapy was widely used to treat HIV. For a more thorough timeline, you can click this link. Acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome or AIDS is the outcome if HIV stays untreated. It is the latest stage of the HIV infection and it is also the most severe. People with AIDS have their immune system so badly damaged, which increases the chances of getting more serious illnesses. Most people with AIDS live for 3 years at most if still left untreated. But more people with adequate treatment can still live on for years. This is a visual representation of how long you before HIV progresses to AIDS without medication. Mm. Next is the biological features of HIV.
So, we heard the relation between HIV and AIDS, pero magfo-focus tayo sa HIV. So, there are two types of HIV, which are the HIV type 1 and HIV type 2. Pero papasadahan lang natin to kasi mas magfo-focus tayo sa HIV type 1. So, ano nga ba yung pagkakaiba nilang dalawa? So, HIV type 1 is the most common cause of AIDS. Ibig sabihin, siya yung most common type ng HIV wherein it occurs all over the world. So, according sa HIV Awareness Charity, around 95% daw ng mga infected ay HIV type 1. So, yung type 2 naman ay nangyayari siya mostly sa West Africa lang and less aggressive siya with slower progression. Mas mabagal siya compared sa HIV type 1. Although parehas sila ng retrovirus and may similar effects sila sa human body, they're still genetically distinct. So kahit na may same silang effects sa katawan natin, is magkakaiba pa din yung genomic structure nila and yung antigenicity. So ibig sabihin, hindi lahat ng tests and treatments ay mag-work for the both of them. So since mas common nga yung HIV-1, magpo-proceed tayo sa structure niya. Next slide po. So yung nakikita niyo sa picture is yung structure ng HIV type 1 virion next to the T-cell surface. So yung HIV type 1 is icosahedral, meaning it is a polyhedron within a 20 phases with a conical capsid. So inside the capsid, there are two identical RNA strands. So it holds HIV's genetic material. Along with enzymes like reverse transcriptase, integrase, and protease, yung mga components na to ay naka-enclose sa capsid or yung core, and it made of P24 capsid protein, and they are surrounded by P17 protein matrix. So let's go to the membrane components or dun sa outer part niya, wherein dito natin nakikita yung mga virally encoded membrane proteins or yung GP120 and GP41 na nakabound to the envelope. So the entire structure is enveloped by a phospholipid membrane and derived from the host cell. So next is yung mga receptors natin na present sa surface. So next slide po. So ito yung CD4 and chemokine receptors, and they act as HIV type 1 receptors. So additional info lang, we also include the genome structures and sequences. So yung structure niya is the RNA genome of HIV is approximately 9.2 kb long, and it has typical retrovirus nucleic acid sequences. Meron ding long terminal repeats, all the LTRs, at each end that regulate viral gene expression, integration, and replication. So ano nga ba yung LTRs? So mas madidiscuss natin yan later before tayo mag-proceed sa life cycle. So lastly is the genetic sequence encoding. So, madali lang naman to intindihin. There are three sequences na nangyayari sa HIV type 1. So, we have the GAG sequence, ENV sequence, at saka yung POL sequence. So, yung GAG sequence, it encodes core structural proteins or yung P17 natin and yung P24. So, next is the ENV sequence. Ini-encode naman nito is yung ang mga envelope glycoproteins natin like the GP120 and GP41. So yung lastly is POL sequence wherein it encodes reverse transcriptase, integrase, and viral protease enzymes na necessary for replication. So next slide po. So para mas maintindihan natin if ano tong mga sequences na to, let's move on to the HIV type 1 genome. So going back to the LTRs or the long terminal repeats, it is found at the both ends of the HIV type 1 genome. And para siyang control center. It also contains important regulatory elements na nagko-control sa expression ng viral genes and sa initiation ng viral replication. So let's proceed sa mga genomes. So yung RNA ng HIV is made up of 9 genes. So there are 3 major genes are group specific antigen or yung GAG, polymerase or yung POL, and envelope or the ENV. So sila yung mga code for structural proteins, envelope proteins at saka enzymes. So yung other 2 genes naman ay yung code for regulatory, the transcriptional activator or the TAT, and regulator of viral gene expression or the REV. And meron din tayong code for accessory proteins. So there are NEF, negative effector, viral ineffectivity factor or yung VIF, VPR or the viral protein R, and of course, the VPU or the viral protein U. So let's proceed sa life cycle ng HIV. So yung life cycle ng HIV type 1, it involved 7 processes. So we have the binding, fusion, reverse transcription, integration, transcription or the translation, assembly, and budding. So dito sa life cycle, i-discuss ko lang siya in a simple way. Yung infection is usually, next slide po. Yung infection is usually nag-occur siya in the blood, semen, or other body fluids of an individual and natatransmit siya by sexual contact, needle stick, or transplacental passage. So una, magkakaroon ng binding wherein yung HIV na i-infect niya yung host cells by binding its envelope protein or yung GP120 spike sa dalawang receptor sa host cells, yung CD4 and chemokine co-receptor. Usually, ito yung CXCR4 or yung CCR5. So, this binding triggers a series of conformational changes in the viral envelope proteins or yung GP41, na nagli-lead sa pagkakaroon ng fusion ng viral and host cell membranes. Then, yung viral RNA ay magre-release siya ng reverse transcriptase and integrase. So this allows the viral RNA ngayon to enter the CD4 cell. So next is, kapag nakapasok na yung viral RNA sa CD4 cell, mare-reverse transcribe siya into proviral or the inactive viral DNA by viral enzyme reverse transcriptase. So ngayon, meron na tayong double-stranded DNA or the viral DNA. So next is the integration. So yung HIV's integrase enzyme ay mag-a-attach siya sa end ng proviral DNA strands. Then dadalhin niya yung viral DNA sa nucleus ng cell. So once na nakapasok na yung proviral DNA sa nucleus, magbabind siya ngayon sa host ng DNA. So after niyang mabind yung HIV DNA, ay mai-insert siya sa host cell DNA. The integrated viral DNA now is known as a provirus. So next is the transcription and translation. Next slide po. So after this process, the provirus can remain latent within the CD4 cell. Yung stage na to ay tinatawag na latency. Meanwhile, the CD4 cell is described as latently infected. Pero kapag na-activated siya by various stimuli, example is the T cell activation or the cytokines, mag-undergo siya ng transcription. So yung CD4 cell ngayon, yung machinery, itatranscribe niya yung viral DNA into mRNA, which is then translated into viral proteins by CD4 cells ribosomes. So some of these proteins is yung mga regulatory proteins, example is the TAT, REV, at saka yung NEF, na nagko-control sa viral gene expression. While yung iba naman ay structural proteins, example is the GAG, POL, tsaka yung ENV, that form new viral particles. So next is magkakaroon ng assembly. So in this phase, newly synthesized viral components including RNA, proteins, and enzyme, so they assemble together sa plasma membrane ng host cell. So yung GAG protein, nakakleave siya or na-split siya by the viral protease to generate mature structural proteins and ma-assemble siya into new virus particle to prepare for budding. So lastly is budding. So sa budding, it simply releases the assembled viral components from host cell. So during budding, yung mga viral structure structural proteins natin, particularly yung mga envelope glycoproteins or yung GP120 and GP41, they interact with host cell membrane proteins na nagli-lead sa budding ng immature virus particles from host cell membrane. So because of the budding, mag-undergo ng maturation yung immature virion wherein magbe-breakdown ng GAG and GAG polyproteins by viral protease. And doon na ma-form yung mature infectious virion. Then, magre-repeat na yung cycle.
Moving on to the pathogenesis of HIV infection and AIDS. HIV infections and AIDS begins with acute infection, which is only partly controlled by the host immune response and later on transitions into chronic phase, which is accompanied by dissemination of the virus, viremia, and the development of the host immune response, and lastly, progression to AIDS. Next. So, this is the clinical course and progression of HIV infection. Let us discuss the step-by-step process on how HIV infection progresses to further understand how the virus spreads from the initial site of infection to lymphoid tissues throughout the body. Sorry po nakatagilid, di kasi kasha, pero don't worry, itatakal ko naman siya isa-isa. So first, the virus enters through the mucosal epithelia wherein the acute or early infection begins. This is the earliest stage of HIV infection wherein HIV multiplies rapidly and spreads throughout the body. As you can see here, the CD4 positive T cells in the mucosal lymphoid tissues get infected and die because of the virus. As we all know, sa mucosal tissue, dito nag-i-stay yung memory T cells natin. So, ibig sabihin, kapag sila ay na-infect and namatay, bababa ang count ng lymphocytes na responsible for fighting off microbes. In fact, ma-infect ka lang for 2 weeks, sobrang daming CD4 positive T cells na agad ang mawawala. At the same time, yung antigen-presenting cells, particularly dendritic cells, capture the virus and then migrates into the lymph nodes. These APCs express a mannose-binding lectin protein called DCSIGN or dendritic cell-specific intercellular adhesion molecule grabbing non-integrin, and alam naman na natin to. These proteins are important for viral infections kasi they bind the HIV envelope and transports the virus. So, ayun, edi nasa lymph node na nga, di ba, yung virus. Yung dendritic cell naman ngayon, pwede na niyang ipasa yung HIV sa CD4 positive T cells through direct cell-to-cell contact. This is when the infection is established in the lymphoid tissues, particularly the lymph nodes. After the first exposure to HIV, viral replication happens in the lymph node, which leads to viremia. Take note, viremia is characterized by a large number of HIV particles present sa blood ng patient. At dahil nasa blood na, mas madali na ngayon ito mas-spread throughout the body. And this infects helper T cells, macrophages, and dendritic cells sa peripheral lymphoid tissues. And dahil dito, nag-i-initiate na ngayon ng humoral and mediated responses para sa viral antigen wherein the adaptive immune system will have a partial control over the replication. This temporarily controls acute infection but does not prevent the establishment of chronic infections of cells in the lymphoid tissues. In the clinical latency or asymptomatic period, the chronic phase of the infection is established wherein there is no clinical manifestation kasi this is when the HIV continues to multiply in the body but in very low levels. Meaning, yung viremia andyan pa rin pero pakonti-konti na lang kasi nga nakokontrol na ng bahagya yung replication. However, the destruction of CD4 positive T cells within the lymphoid tissues steadily progresses, but this loss is corrected by replenishment from progenitors. Cytokine stimuli, as mentioned earlier, such as TNF or the tumor necrosis factor, induced by other microbes serve to enhance HIV gene transcription, thus boosting the viral reproduction. HIV disease progresses to the final and once almost invariably lethal phase called AIDS. The continuous cycle of virus infection, T-cell death, and new infection leads to a detectable loss of CD4 positive T cells from the lymphoid tissues and the circulation. The loss of these lymphocytes is the main reason that patients with AIDS become immunosuppressed and susceptible to many different types of infections. So for this graph, So letter A, it just wants to show us the number of CD4 positive T cells in viremia as weeks or years go by. The blue line represents the CD4 positive T cell count and the brown line represents viremia. As the viremia increases, the T helper cell count decreases, and about 12 weeks after primary infection, we can see na bumaba na yung amount ng viremia and tumaas naman yung T helper cell count as discussed earlier. However, as years go by, nagkakaroon ng decline sa count ng CD4 positive T cells which is probably caused by cytokines and other microbial infections. And because of this, tataas uli ang viremia and magpo-progress into AIDS. Yung letter B naman, pinapakita yung immune response ng katawan against HIV infection. So moving on to the clinical features of HIV infection, the table on the right is just a summary of the phases of HIV disease and their clinical manifestations as discussed earlier. In addition, HIV infected patients have an increased incidence of tumors, particularly Kaposi's sarcoma and EBV associated B-cell lymphomas and encephalopathy. Researchers are still unsure of the exact mechanism that causes HIV encephalopathy to develop. However, most evidence suggests that it stems from the inflammation and damage that occurs when the virus crosses the blood-brain barrier and affects the brain. Fortunately, the incidence of these complications has been greatly reduced by antiretroviral therapy. So, for the mechanisms of immunodeficiency caused by HIV infection ultimately results in impaired function of both the adaptive and innate immunity. The most prominent defects are in cell-mediated immunity, and they can be attributed to several mechanisms, including the direct cytopathic effect and indirect effects. So, the direct cytopathic effects, there is a significant decrease in CD4 positive T cell production, and this is the hallmark of the infection through the following mechanisms. First is the loss of plasma membrane integrity due to viral budding, which induces apoptosis or osmotic losses of the cell caused by the influx of water. Second is the CTL-induced apoptosis, wherein the HIV-specific cytotoxic T lymphocytes and antibodies against HIV envelope proteins may bind and kill the infected CD4 positive T cells. Third is the APC abnormalities. Macrophages, dendritic cells, and follicular dendritic cells can be infected by HIV but cannot be injured. However, as these cells form intimate contact with naive T cells during antigen presentation, they can infect them and this will lead to the spread of the virus. And lastly, the viral induction of apoptosis or the direct killing of the T helper cells. And the second effect is the indirect effects, which are important in the pathogenesis of HIV infection because many or even most infected T cells may be abortively infected, meaning the virus fails to replicate, thus there are no direct cytopathic effects. Indirect kasi oo, na-infect niya yung cell, pero hindi nagkaroon ng effect kasi hindi nakapag-replicate yung virus.
The immune response to HIV is mainly adaptive. There are both humoral and cell-mediated responses that do develop after infection, but it generally does little help since the virus does attack the immune system itself. Actually, yung initial response niya is very similar sa response to other viruses, with the goal of eliminating all of the virus sa body. Pero hindi siya nagiging successful kasi mas madaming namamatay na immune cells kaysa sa napapatay na virus. Although it's not successful, the immune response still has its benefits. Kasi nga, it is still an adaptive immune response. Therefore, antibodies will still be produced, which is sobrang helpful sa pag-diagnose ng HIV and also by knowing how the immune system responds to the virus helps for vaccine research. HIV antibodies become detectable within 6 to 9 weeks after infection, which means it can be diagnosed with screening tests as early as 6 weeks. These are some of the ways that they have tried to formulate HIV vaccine, pero up until now, unsuccessful pa rin. The mechanism of immune evasion. HIV is the very first infectious pathogen that destroys the immune system in order to evade it. It also has a high mutation rate, helping the virus to evade detection by immune cells that are looking for the initial viral protein. Because studies have shown that the virus undergoes mutation in every possible chance every day. Kaya sobrang hindi siya mahanap ng T cells or immune cells. It also downregulates class 1 MHC expression. HIV has a NEF protein which inhibits the expression of class 1 MHC molecules. For treatment, for HIV, there are nucleoside analogs, which was the very first treatment that was made available. And also, the modern treatment is the highly active antiretroviral therapy, HAART, also called antiretroviral therapy or ART. This is the newer go-to treatment today, and it is a combination of three drugs: the AZT, deoxycytidine nucleoside analogs, and deoxyadenosine analogs. Individually, these drugs can reduce levels of plasma HIV RNA, but it is not enough to stop the progression of the disease. This new method has been proven to be very effective in slowing down the progression and is successful in lowering the plasma HIV RNA into undetectable levels, which is why patients that undergo this treatment can live for more than 10 years after diagnosis. For AIDS, since the disease has progressed severely, treatment is more aggressive in order to combat the virus. Most cases are treated with antibiotics and mostly supportive measures. The best thing to do kapag umabot na sa AIDS is agapan na lang yung mga infections na nakukuha ng patient, hoping na makalaban yung immune system nila. For prevention, the precautionary measures na lang is to practice safe sex, don't reuse needles, take PrEPs or PEPs, which is pre-exposure prophylaxis and post-exposure prophylaxis, and get regularly tested and spread awareness. As of now, wala pa ding vaccines available for HIV and AIDS. Yun, references.